Welcome, learners. Get ready for a truly fascinating deep dive today.
We're stepping into the world of a plant that's, well, as beautiful as it is infamous.
A substance shrouded in both mystery and uh, powerful medicinal properties. We're talking about belladonna.
Often known as deadly nightshade, yeah.
We've got some incredible source material today from William Boericke's Homeopathic Materia Medica.
A foundational text, really. It meticulously outlines the specific actions and applications of various substances.
And our mission today is to unpack the incredible breadth of belladonna's influence on the human body. Explore how something so potent could be, both a dangerous poison and a precise medicine.
Right. We'll look at its dramatic effects, particularly on the nervous system.
And then see how its active compounds are put to some surprising therapeutic uses.
Mm-hmm.
Now, you might already associate belladonna with poisons, potions, that sort of thing. And you'd be right.
Absolutely. But what's truly fascinating is its detailed profile in this historical medical text.
It shows us how deeply its properties have been studied, doesn't it? Leading to insights that kind of bridge centuries of medical understanding.
Indeed. What's compelling is how the source meticulously details belladonna's widespread impact, especially, as you said, on the nervous system.
Yeah.
It describes active congestion, intense excitement, even what it called perverted senses.
Perverted senses.
Wow. It also highlights a marked action on the vascular system, skin, and glands. Essentially, it creates a very intense, dramatic state within the body.
Okay, let's unpack this then. Let's really try and discover the dual nature of this powerful plant.
None's good.
So when you look at the core characteristics of belladonna in the source, it describes it as always being associated with a very specific, almost theatrical presentation.
Theatrical is a good word for it. Think hot, red skin, a flushed face.
Glaring eyes, throbbing blood vessels like the carotids.
Right. An excited mental state and this hypersensitivity of all the senses.
It's a picture defined by heat, redness, throbbing, and burning. Those seem to be the key descriptors.
Precisely. And what really stands out is the violence of attack and suddenness of onset.
So it's not gradual.
No, not at all. The symptoms hit hard and fast, often appearing almost out of nowhere.
And the text even surprisingly calls it a great children's remedy, which sounds counterintuitive.
It does, but it's not because it's gentle. It's because it so often matches the sudden, intense fevers and inflammations you see in children.
Okay. So it's about matching the pattern of the symptoms, the intensity.
Exactly, matching the pattern.
And speaking of unique patterns, one of the most memorable symptoms mentioned is this dryness of the mouth and throat.
Very dry.
But here's the kicker. It comes with an aversion to water.
Right. You'd absolutely expect someone with a dry mouth to crave water.
But with belladonna, it's often the opposite. That's a detail you won't forget.
It's a classic keynote. It's also noted for neuralgic pains, these sharp, sudden nerve pains that just come and go abruptly.
Like flicking a switch.
Pretty much. And even epileptic spasms that are often followed by nausea and vomiting.
And its specific indications. They extend to things like scarlet fever.
Yes, where it's not just a treatment, but was also historically used as a prophylactic to prevent it, basically.
Using a specific potency.
Specifically, the 30th potency is noted, which in homeopathy indicates a very highly diluted form of the substance.
Okay. And it's also mentioned for conditions like exophthalmic goiter.
That's a thyroid condition where the eyes can appear to bulge, yeah.
And even for air sickness in aviators as a preventative.
Which is fascinating. And a key detail there is that when used for air sickness, it specifically notes no thirst, anxiety, or fear as part of its effect.
Interesting. So we're seeing this pattern. Intensity, suddenness, and sometimes really unexpected reactions.
Definitely.
Given this intense physical picture, what happens when belladonna impacts the mind? It sounds like, well, a world of its own.
It absolutely is. The patient described lives in a deeply altered state. They're engrossed by specters and visions, completely oblivious, it seems, to surrounding realities.
So their actual eyes might not register real objects, but their mind is just flooded.
Flooded is right. With a host of visual hallucinations, monsters, hideous faces, truly frightful images.
It's hard to imagine that level of sensory overload. So they're acutely alive in a sense, but crazed by these internal images and fantastic illusions. What does that look like from the outside?
The delirium is described as furious. It can lead to raging, biting, striking, with a distinct desire to escape.
So quite violent, potentially.
Potentially, yes. There can be a loss of consciousness, a disinclination to talk, even perversity accompanied by tears.
And yet, despite this internal chaos, all senses are acutely heightened.
That's the paradox. They might be painfully sensitive to light or noise, for example, but their perception is completely distorted. Changeableness is also a key feature.
So, a complete sensory and mental whirlwind.
Okay.
Let's zoom in a bit. How does this intensity and sensitivity manifest in specific areas? Maybe starting with the head and face.
Sure. For the head, the pain is often described as a throbbing, bursting sensation, especially in the forehead.
Intense, you mean?
So intense that people might bore their head into the pillow or cry out suddenly. It's often worse from light, noise, any kind of jolt.
Painting a picture of extreme sensory overload again.
Exactly. What's also unique is that while lying down can worsen the pain, applying pressure or sitting in a semi-erect posture often brings relief.
Interesting. And the face itself, we're back to that theme of redness and heat.
Exactly. The face is typically red or sometimes even a bluish red, hot, swollen, and shining,
Shining, okay.
often with convulsive muscle movements and maybe a noticeable swelling of the upper lip. Facial neuralgia, nerve pain in the face with twitching muscles is also very characteristic.
And the eyes, equally dramatic, I assume.
Oh, yes, a deep throbbing pain within the eyes, especially when lying down. The pupils are noticeably dilated.
Making them look wide and dark.
Right, and the eyes themselves appear swollen, protruding, staring, and brilliant.
Brilliant, like glassy.
Kind of, yeah. And the conjunctiva, the white part, is red, dry, and burning, with significant photophobia, that extreme sensitivity to light. Ocular illusions like seeing fiery appearances, diplopia or double vision, squinting, lid spasms. It's quite a list. And exophthalmos, too.
Wow, that sounds incredibly painful and disorienting. And the ears, does this hypersensitivity extend there?
Indeed. The ears can experience tearing pain and incredibly acute hearing, almost painfully acute.
It's like hearing things too loudly.
Exactly. Otitis media, or middle ear inflammation, is highlighted. The pain there can be so severe it actually causes delirium.
Delirium from ear pain.
Yes, and children might cry out loudly in their sleep because of the throbbing pain, which can be synchronous with their heartbeat. Humming noises, hematoma oris, autophony, hearing one's own voice, strangely, are also mentioned.
Okay. And what about the nose, mouth, and throat? Similar intensity.
Pretty much. The nose can experience unusual sensations like imaginary odors or tingling at the tip. It often appears red and swollen.
And you mentioned bleeding.
Yes, a distinctive symptom is bleeding of the nose accompanied by a flushed red face.
Okay. And the mouth.
Dryness is prevalent, we mentioned that. Also, throbbing pain in the teeth, maybe a gum boil. The tongue is often red just on the edges.
Like a strawberry.
Exactly. The source calls it a strawberry tongue. And there can be grinding of teeth and a swollen, painful tongue generally.
The throat sounds just as inflamed.
It is described as dry, as if glazed, with an angry looking congestion that's notably worse on the right side.
Specific side. Okay.
The tonsils are enlarged, the throat feels constricted, and there's difficult deglutition trouble swallowing, particularly worse with liquids.
Worse with liquids than solids. That's unusual.
It is. There's often a sensation of a lump, spasms in the throat, and this continual uncomfortable inclination to swallow, even though it's difficult.
Wow. Okay. So the theme of heat, redness, suddenness, and this sort of spasmodic action continues. Moving further down the body then to digestion, elimination, reproduction. What unique patterns do we see with belladonna there?
Well, in the stomach, there's often a loss of appetite. An aversion to meat and milk is mentioned. Spasmodic pain in the upper abdomen.
Epigastrium, yeah.
And a sensation of constriction where the pain kind of runs through to the spine. Now, what's particularly noteworthy here, especially after we talked about the aversion to water earlier,
Yes.
is the great thirst for cold water when it comes to the stomach symptoms.
So it can cause thirst too. That shows the paradoxical nature, right?
Exactly. It's often contradictory. We also see spasms of the stomach, empty retching, sometimes a dread of drinking even with thirst, and even uncontrollable vomiting.
And the abdomen. You mentioned extreme sensitivity earlier. What's that like?
The abdomen is often distended and hot. The transverse colon might even protrude like a pad. It's tender, swollen.
And the pain?
Pain described as if clutched by a hand, made worse by any jar or pressure. Cutting pain across the abdomen, stitches sometimes on the left side, but the extreme sensitiveness to touch.
Even bedclothes.
Yes, even the weight or touch of bedclothes can be agonizing. That's a really striking feature.
That sensitivity sounds truly remarkable. How does this extend to elimination? The bowels and bladder.
In terms of stools, they can be thin, green, or dysenteric. sometimes appearing in lumps, like chalk.
Like chalk. Okay.
There's stinging pain in the rectum, possibly spasmodic stricture, sensitive hemorrhoids, even a prolapse of the anus.
In urine.
Retention is common, acute urinary infections, sometimes a strange sensation of motion in the bladder, almost like a worm.
Oh, strange.
The urine can be scanty with tenesmus, that persistent urge even when the bladder is empty, dark and turbid. But paradoxically again, it can also be frequent and profuse, and sometimes contain blood, hematuria, even when no other obvious cause is found. Prostatic hypertrophy or enlargement is also noted.
Okay. And for the male and female reproductive systems.
For males, testicles can become hard, drawn up, inflamed. Nocturnal sweating of the genitals might occur, maybe a flow of prostatic fluid, and diminished desire.
And for females.
A very sensitive forcing downward sensation, as if all the internal organs would protrude through the vagina.
That sounds distressing.
Very. Dryness and heat of the vagina are present, along with dragging pains around the loins and pain in the sacrum, the lower back.
And with menses, is there that same intensity and heat we've seen elsewhere?
Absolutely. Menses are often increased, bright red, too early, too profuse, and notably, the hemorrhage is hot.
Hot blood.
That's how it's described, cutting pain from hip to hip. And both menses and lochia, that's the postpartum discharge, can be very offensive and hot. Labor pains tend to come and go suddenly.
Like the neuralgic pains.
Exactly the same pattern. Mastitis, or breast inflammation, is described with pain, throbbing, redness, maybe streaks radiating from the nipple. Breasts feel heavy, hard, and red.
Also related to breast tumors.
Tumors of the breast are noted, with pain worse lying down. Badly smelling hemorrhages, hot gushes of blood, and sometimes diminished lochia are also listed.
Okay. Moving on to the respiratory system, heart, and extremities. We continue to see these dramatic physical manifestations. What's happening in the lungs and throat area?
There's a drying sensation, nose, throat, larynx, trachea. This leads to a tickling, short, dry cough, which is particularly worse at night.
A night cough, okay.
The larynx feels sore. Respiration can be oppressed, quick, unequal. Even that distinctive Cheyne-Stokes breathing pattern sometimes.
Where the breathing waxes and wanes.
Right, with periods of apnea, no breathing, hoarseness, or a complete loss of voice is common. Sometimes it's painless hoarseness. The cough can be barking or like whooping cough. The larynx is often very painful, feeling as if a foreign body were lodged there.
Like something stuck.
Exactly. A high piping voice and moaning with every breath are also characteristic sounds.
And the heart. Does it follow this pattern of sort of throbbing intensity?
Yes, very much so. The heart itself can experience violent palpitation, even reverberating up into the head. Labored breathing often accompanies it.
Just from minor effort.
Palpitation from the least exertion, yes. And there's a throbbing sensation felt all through the body, even a unique double beat feel to the pulse, which is called dicrotism. The heart can even seem too large subjectively. The pulse is typically rapid but weakened.
Okay. And in the limbs, the extremities.
Shooting pains along the limbs are noted. Joints can become swollen, red, shining, sometimes with red streaks radiating outwards, looking very inflamed.
Like erysipelas.
Similar appearance, yeah. There can be a tottering gait, shifting rheumatic pains, a condition known as phlegmasia albidolens, or milk leg, which is a severe inflammation, usually post-childbirth.
And involuntary movements.
Jerking limbs, spasms, involuntary limping are seen, and often, despite all the internal heat and redness elsewhere, the patient has cold extremities.
Cold hands and feet, right.
Yeah.
And the back. Anything specific there?
A stiff neck is mentioned, and swelling of the glands of the neck. Pain in the nape as if it would break. Pressure on the dorsal or upper back region is noted as being particularly painful. Lumbago, lower back pain, often with pain radiating into the hips and thighs.
So a general picture of inflammation, spasm, and intense sensitivity pretty much everywhere.
It sums it up well, yeah.
Now, when it comes to the skin and fever, Belladonna presents a truly fiery picture, doesn't it? What defines the skin's reaction?
The skin is described primarily as dry and hot, swollen, sensitive. It burns scarlet and feels smooth.
Smooth, okay.
It can develop an eruption that looks a lot like scarlatina scarlet fever, which spreads suddenly. We see erythema, just redness, pustules on the face sometimes. Glands are swollen, tender, and red.
It covers things like boils, too.
Yes, boils, acne rosacea, even suppurative or infected wounds. A very unique feature mentioned is the alternate redness and paleness of the skin.
Switching back and forth.
Apparently so, and indurations hardened areas that can form after inflammations or erysipelas.
And the fever itself sounds very distinct, not just high, but different.
It is. It's described as a high feverish state, but with a comparative absence of toxemia, meaning the patient looks incredibly sick with the fever, the heat, the redness, but the underlying toxic process, the poisoning of the system, might not be as severe as the outward appearance suggests.
Interesting distinction.
The heat is described as burning, pungent, and steaming. You can almost feel the heat radiating off them.
But cold feet.
Often, yes, feet can be icy cold. Superficial blood vessels are distended, giving that flushed look. Perspiration is dry, except maybe only on the head. And crucially,
The thirst thing again.
no thirst with fever. This is repeated. It's a really striking characteristic that helps differentiate it from many other high fevers where thirst is prominent.
Okay, no thirst with fever. Got it. The sleep patterns associated with belladonna sound pretty disturbed too.
Oh, definitely restless. Patients often cry out, grit their teeth. They might be kept awake just by the pulsation of their own blood vessels.
Feeling their pulse everywhere.
Exactly. Screaming out in sleep is noted. Sleeplessness combined with drowsiness so they're tired but can't sleep, or a tendency to startle violently when closing their eyes or during sleep.
And a specific sleeping position.
Often mentioned as sleeping with their hands under their head.
Interesting detail. And its modalities, the patterns of what makes things worse or better seem very clear cut, right?
Yes, the source is quite precise on this. Symptoms are reliably worse from touch, any jarring motion, noise, drafts of air in the afternoon, and from lying down.
Okay, worse lying down.
And they are generally better with a semi-erect posture, like propped up, and often from pressure.
Pressure helps the pain?
Often, yes. These clear patterns are really key for identifying the belladonna state in the homeopathic context.
Speaking of which, within that homeopathic context, the source also details belladonna's relationships with other substances.
Right. It mentions it as complementary to calcarea carb, incompatible with acetum aceticum or vinegar, and its antidotes include things like camphor, coffee, opium, and aconitum.
And in terms of typical dosages used in this specific text,
It notes the use of potencies ranging from the first decimal up to the 30th centesimal and even higher, often repeated frequently in acute diseases.
which highlights that within homeopathy, the goal is using these highly diluted substances to trigger a healing response by matching that symptom picture we've been discussing.
Precisely. It's about the symptom similarity.
So that's belladonna as understood and used within a homeopathic framework.
Hmm.
But the very same plant yields this powerful compound called atropia or atropine,
Yes, its main alkaloid.
which is used in a completely different way, often in much more material doses in conventional medicine.
Absolutely different application.
So this raises an important question. Beyond its homeopathic applications, what other uses does this text highlight for belladonna's alkaloid, atropia?
Right, and this is where the practical applications really shine in a different light, using the substance directly for its physiological effects.
So what are some examples?
Well, atropia and its salts are famously used for ophthalmic purposes, applied directly to the eye.
For dilating the pupil.
Exactly, to dilate the pupil and also paralyze accommodation, that means it temporarily stops the eye from focusing. A very direct, non-homeopathic use that many people might recognize from eye exams.
That's a classic one, but it's also used internally, right? As an hand.
Yes, internally or injected under the skin hypodermically. It acts as an antagonist, a counteragent to various potent substances.
Like what?
Think opium and morphine, phasostigma, prussic acid, other narcotic poisons, even certain types of mushroom poisoning. This highlights its really critical role as an antidote in emergencies.
So life-saving in some cases.
Potentially, yes.
And it has some very specific applications for pain and internal issues too, according to the text.
Absolutely. It's mentioned for specific conditions like renal colic, that's severe kidney stone pain.
How is it used there?
A tiny dose. The text mentions 1/1200th of a grain given hypodermically.
Tiny, but still a material dose compared to homeopathy.
Oh, yes, definitely. For intestinal obstruction that's threatening life, subcutaneous injections are noted, starting from maybe a milligram upwards.
And for night sweats.
A dose of 180th of a grain hypodermically is mentioned, used to combat night sweats, especially in conditions like phthisis, old term for tuberculosis.
So it's quite a versatile compound then, used as a local anesthetic sometimes,
Yes, an antispasmodic, meaning it reduces muscle spasms.
and even to dry up secretions, like breast milk.
Exactly. It has an anti-secretory effect. The specified dose for atropia sulf, one of its common salts, is typically
And the potency, when you're dealing with such a powerful compound directly.
It's a world away from the homeopathic dilutions, isn't it? Yet both approaches draw knowledge from observing the effects of the same plant.
So, okay, what does this all mean for us? We've done this deep dive into Belladonna deadly nightshade using Boericke's text. We've seen a substance capable of producing these dramatic, even terrifying symptoms,
Huh?
yet it's been meticulously documented and applied in vastly different medical contexts, homeopathically and conventionally via its alkaloid.
And if we connect this to the bigger picture, it really underscores the incredible power locked within natural substances. And also the detailed, almost obsessive observation required in historical medical practices.
Obsessive is a good word.
Belladonna's profile is just such a testament to how deeply its effects were understood, or at least cataloged, allowing for both its careful avoidance as a poison and its strategic application as a medicine.
And those unique characteristics like no thirst with fever or the patient living in a world of specters.
They really stand out, don't they? They give it this unique, unforgettable signature.
Absolutely. This deep dive has shown us not just what belladonna does, but maybe why such intense, granular observation was so necessary to even begin to understand and harness its power.
Yeah.
It's a vivid reminder that even the most potent substances have these precise, sometimes contradictory effects. Each one is like a clue, isn't it? A clue to how it interacts with the human body.
Precisely. And it encourages us, I think, to consider that fine line between poison and remedy and the historical understanding of plant pharmacology that often predates our modern scientific tools, but was incredibly detailed in its own way.
So, as you, our listeners, go about your day,
Yeah.
perhaps consider this. How does the kind of precision required to understand and utilize something as potent as belladonna influence our modern approach to medicine and how we understand the natural world?
Mm.
And maybe think about what other deadly plants might still hold hidden medicinal secrets, just waiting for us to unlock their full potential.
Always more to learn.
Definitely.
Mm.
Well, that's all for this deep dive. We hope you're feeling a little more well informed and perhaps a lot more curious about the remarkable and often surprising world of belladonna.
Until next time.
Until next time.